Hey, I am back. I am back. I am back. Welcome to this lesson. This lesson is Patient Assessment Medical. So here it is, Patient Assessment Medical. We did the scene size up. Now we're going to go into the primary assessment. Start off with the primary assessment with LISA, L-I-S-A. L stands for life threats. What is a life threat? Here it is, uncontrolled bleeding, someone choking, someone on fire, literally on fire, someone not breathing, someone in cardiac arrest. Those are like life threats that we gotta stop everything, fix it, and once we fix it, we move on. Impression, what you see in front of you. I have a patient sitting, gender, and if they're conscious. Very simple. And then from there, that's your eye. Eyes, I see, right? You can use that too. Pretty cool. I see. L-I-S. Sir, ma'am, my name is, whatever your name is, for this video, my name is Zach. And by any chance, do you have any recent falls? Are you complaining any neck or back pain or any injuries? No? Okay. But if they did, they would have to stabilize the head from moving because there's a possible spinal injury. All right. So L-I-S-A. So A will be very simple. AVPU. A-V-P-U. So let's ask the questions. Hi, my name is Zach, EMT Zach. I have a few questions for you. What's your name? Okay. Playing a role. Here's the W's, all right? What's your name? Where are you? What time of day it is? And what happened? Those are the W's, right? Multiple W's. But those words, those are open-end questions. Open-end questions. So let's go. So you got that. And once the patient answers all of those questions, then they are alert. Very simple. Because remember, we have A, V, P, U. That's it. So we have to get a letter and assign them a letter. So if they answer all four, then they are A. So again, what's your name? Where are you? What time of day it is? And what happened? All right. Once they answer all four, then guess what? They are alert. Next and last is going to be the airway. So with medical is super easy. Airway. Sir, your airway's open. Patient's airway's open because they're talking to me. Very simple. The airway's open because they're talking to me. That's A. B. B step. I'm going to look, I'm going to listen, and I'm going to treat. Look, listen, treat. I don't see any cyanosis. I don't see any pursed lip breathing. All right. I see equal rise and fall of the chest. Do I see any accessory muscle use? Muscle use is up here, the neck area, chest. All right. And my patient appears to be breathing adequately to sustain life. Then from there, you look. Now you're going to listen with your stethoscope. Once you listen to the stethoscope, you're going to look to two lung fields, which is going to be here. This is the axillary line. It's going to be mid-axillary on both sides. You're going to say lung sounds are clear, equal, and bilateral. Say it. Good. So we did the B step, look, you listen. Now we're going to treat the patient. So we said earlier that it's chest pains. We're going to treat the patient with a non-rebreather at 15 liters of oxygen. Okay, very simple. And you're done. That's the B step. The next step is the C step. All right, there are different mnemonics for everything. I'm just giving you one. If you already have one set, that's all right with me. That's cool. As long as you get it done. That's important. So here it is. Ready? Channel 13 in New York, I know, is PBS. NBC is channel 4. ABC is channel 7, right? So every radio channel has letters. And the way I remember and the way I was taught was PBSS. P stands for pulse. So once your patient is responsive, you're going to check their radio pulse first. Both. You're going to check for it to see if it's present and if the quality of it or the regularity. Then from there, pulse. Then B is bleeding. Do I see any external bleeding? If I don't see any external bleeding, guess what? That's good. Whatever the instructor says, that's what it is. Now I'm going to ask for internal bleeding. Internal bleeding is looking to see if the patient has any internal bleeding, so you can ask a few questions. So have you noticed here's the questions, any urine, any blood in your urine? Have you vomit any blood? Or you defecate any blood? And that's the questions. And I'm gonna go through the whole thing. And if they say no, awesome, that's good. Don't have to worry about it. So C step, P, B, S. With your gloves, S. You're checking the core. All right, the warmness. Checking up here, not too good because you're going to go outside in the cold and you don't have a hat on and you touch and it's like, oh, he's cold. So check the skin. We're going to check the color, temperature, condition, or color, temperature, moisture. And so now the patient's skin for normal would be warm, dry, unremarkable. Say it. Good. Warm, dry, unremarkable. So that's exactly what you're going to say. That's usually for a normal patient. And based on what they present to you, you treat accordingly. So for example, if the patient is pale, cool, and moist, or diaphoretic, then you'll treat for shock. That's P, B, S, S. So there's another S, and that S is treat for shock. So in this case, we're not going to elevate legs and do these. We don't do that. But we're going to cover, maintain body temperature, and the patient is already in oxygen. So once you've done that, the C step, now you're going to go to the D step, which is making your decision. So based on everything that you got from the top to the bottom, then you're going to call for advanced life support, or ALS, or paramedics. So at that point, you're going to say to the instructor, this is my decision. I'm going to request for ALS. And then you ask for ETA, estimate time on arrival, on the ALS, and what's the ETA for the nearest hospital. So based on which one is quicker, you will either wait for the paramedics or you're going to transport to the nearest hospital. And let's say the instructor says, well, what do you have? I have a patient at the age 22 years old, let's go for it, who's complaining of chest pains, shortness of breath, and this is what you're given. You gave him some medication, you warmed the patient, and a very brief thing. So that's going to be your primary assessment. All right, so now I'm going to demonstrate it, all right, before you. So here it is, you ready? So we did the scene size up already. Lisa, do I see any life threats? No. I see a 34-year-old male sitting and appears to be conscious. Is that what I have? L-I-S. Hi, sir. My name is EMT Zach, and have you had any type of recent falls? Do you have any pain in your neck or back, or any injuries? No? Okay, no need to stabilize. Okay, L-I-S-A. I'm going to check. Hi, my name is EMT Zach, and I'm going to ask you a few questions. What's your name? Where are you? What time of day it is, and what happened? Okay. You have chest pains? Oh, I'm so sorry to hear that. All right, so from there, my patient is alert. My patient's airway is open because they're talking to me. I'm going to see and check for cyanosis, looking for pursed lip breathing. Do I see any accessory muscle use? Any chest rise, right? Equal chest rise and fall. And my patient appears to be breathing adequately. Is the patient breathing adequately, instructor? Yes. And he has shortness of breath and some chest pains. We're going to give him an oxygen normal breather, 15 liters per minute. I'm going to check his radial pulses. Pulses are strong and regular. All right. I don't see any external bleeding. Do I see any? Okay. I am going to ask my patient some questions. Have you noticed any blood in your urine, your stool, or vomiting any blood? Have you? Nope. Okay. I'm going to assess the skin with gloves on. It's warm, dry, and unremarkable. Whatever they give me, I'm going to, if it's needed to treat for shock, I'm going to put a blanket. Once I've done that, this is going to be a rapid transport. Can I get ALS? Matter of fact, what's the ETA for ALS? The ETA for ALS is 5 minutes. And what's the ETA for the nearest hospital? 10 minutes. All right, so we're going to send medics to come to this location. What do you have? I have a 35-year-old male with complaining of chest pains, difficulty breathing, and from there, I'm going to provide oxygen for him. And that concludes it. That's the primary assessment. So what I'd like you to do right now is to watch this video, get it done, and understand it. Remember, practice it over and over again, piece by piece. This is the way I can give you a whole 2-hour lecture on it right now, but I'm breaking it piece by piece. So know the same size up from the last video. Do it over and over and over. From there, watch this video over and over and then put it all together. All right, I'll see you in the next video and keep practicing. All right, bye.